Patients say in between the ages of 20 to 40, they usually come to us with pain in the knee joint following an injury. And these are usually sporting injuries. And they tend to have had a fall or a twisting injury to the knee joint, after which they might hear a click in the joint, or the knee might give way on them. It might swell up and they may not be able to play the sports that they like. So these common injuries at this age are usually either a cartilage tear, which is a meniscus tear, or a cruciate ligament tear, which is the main ligament in stabilizing the knee joint, and also collateral ligament injuries. And these are the commonest injuries seen at a younger age. Now typically in females between the age of 40 to 50, they present with what we call as an anterior knee pain. These patients usually describe pain climbing up and down the stairs, getting up from a sitting position, or if they are in bed and they wake up, the first thing that they notice is significant amount of pain in the knee joint, and that is grouped together as anterior knee pain. It is not serious, usually seen in females but also seen in males between age of 45 to 50, typically in either badminton players or runners. Majority of these problems will be treated with simple physiotherapy. So as soon as you start exercises to build up strength in the muscles, the pain will disappear over a period of a month or 6 weeks. So these are simple problems. These are not because of arthritis. So the patient need not be worried about these symptoms. Now at the age of 50, usually patients come to us with pain because of arthritis. And the arthritis might be either very early stages where the gap is between the bones is not reduced, and in these cases, if the symptoms are mild, we treat them with either physiotherapy, calcium supplements, simple analgesics, and also if required an injection in the knee joint of a lubricant which is called as hyaluronic acid, and that tends to help in about 40 to 50% of patients. And once the pain becomes constant, arthritis progresses, and on the X-ray it shows that bone is rubbing onto bone, and the patient is disabled with deformity, then he might benefit from a knee replacement surgery. When we recommend a patient to follow some set of exercises, we like to do that under a guidance of a physiotherapist. So depending on what problem they have in the joint, we strengthen their quadriceps muscles, the thigh muscles, or the hamstring muscles, which allow them to recover from these issues quite fast. And medications are the simplest painkillers for the shortest duration required for acute pain, but chronic pain is usually managed with the help of physiotherapy, and in elderly patients maybe using a stick which will take away 2/3 of the body weight, and they will be able to walk longer distances. Sometimes we give them a little support or a brace, which again helps their symptoms. And very rarely we might consider giving an injection into the knee joint of a lubricant solution.